Did you know Congress is proposing a bill that could impact $700 billion in Medicaid funding? This isn't just about numbers. It affects your grandma's nursing home stay, your neighbor's insulin, and vital neonatal units in rural areas. 1 in 4 Americans relies on Medicaid. If you or anyone you know does, this proposal directly affects you. The House plan is harsh. It sets a strict cap on federal Medicaid dollars. If more people need help, funding won't increase. Adults would have to prove they work, go to school, or volunteer at least 80 hours a month. Plus, it eliminates the Affordable Care Act bonus that expanded coverage in some states. What does this mean for you? Co-pays could soar to $35 per doctor visit. Eligibility checks might happen twice a year. A missed letter could cost you your coverage. If you face an emergency, you might get hit with a surprise bill. Low-income adults in non-expansion states could remain stuck without coverage. There's a potential upside, though. A ban on pharmacy benefit manager spread pricing might lower drug costs. But experts disagree on how effective this will be. Now, what about the Senate version? It keeps much of the same, but changes the details. Parents with kids under 15 are exempt from the work requirement for now. States would have until 2028 to implement some rules, but co-pays for non-emergency ER visits could rise even more. They also limit emergency Medicaid funds, shifting costs to hospitals treating undocumented patients. Confusingly, retroactive coverage would split between 1 month and 2 for different groups. On the money side, the House limits certain tax loopholes for providers, while the Senate makes existing loopholes tighter gradually. Both chambers want to restrict Medicaid dollars from abortion-related services, but the Senate lowers revenue thresholds for smaller clinics. So who wins in this proposal? Budget-friendly advocates might cheer, and drug buyers could see benefits. However, rural hospitals, non-expansion states, and low-income individuals face serious challenges. Timing is everything. The House changes begin in 2027. The Senate pushes most actions to 2028. That gives states a bit more time, but also creates uncertainty. After the bill passes, regulators will have 180 days to establish new rules. How they interpret key terms will hugely impact whether you keep your coverage. Lobbyists are working behind the scenes as you watch this. If Medicaid matters to you, now's the time to engage. Call your representatives, leave comments, and make your voice heard. Your health and your financial future could be at stake.